Thank you for coming and listening today. My name is Emma Twir. This is the class of Bio 444, the biology of love and sex. And today I will be going over my poster overviewing the research I've done on the effect of substance abuse on sexual behavior, thoughts, and feelings. Drugs actually act on the brain circuits that mediate motivation and reward. And so they act on the endogenous neurotransmitter systems that regulate the rewarding behavior in your brain, which include the dopamine systems, opioid, endocannabinoid, serotonin, and the noradrenaline systems. And psychoactive drugs can impact your sexual function, performance, your libido, and your arousal. And then an issue and big reason why there's so much research on this topic is that drug users are consistently identified with elevated rates of sexually transmitted infections such as HIV. So the substances that I address in this poster and that are reviewed in the 3 different research papers that I picked are alcohol, sedatives such as opiates and cannabis, and stimulants such as cocaine and methamphetamine, and then lastly GHB, which is a date rape drug. The overall purpose of this poster was to examine the relationship between substance use and sexual behaviors in patients that have a substance use disorder. And then the overall hypothesis is that substance use does actually affect your sexual behavior and can increase sexually risky behaviors. So some of the materials and methods used in these studies was a substance abuse and sexual behavior questionnaire. There was also a measurement of addiction for triage and evaluation that was completed by a professional interviewing the patient. And then some analysis done on the results included MANOVA analysis, Pillai-Trace, Gams-Howell post-hoc test, the Kruskal-Wallis test, the infamous chi-square test, and then lastly the Mann-Whitney test. And so there's some other surveys including sociodemographic, substance use, sexual behavior, and child abuse surveys. And those surveys were analyzed by Kolmogorov-Smirnov test, the Pearson's chi-square test again, and then the Mann-Whitney test as well. So most of these are survey-based. As you can see, there was another self-report survey, which was also analyzed by the chi-square and the post-hoc tests. So for the first results, this is for the first study. As you can see in Table 1, all 4 groups reported, which is alcohol, sedatives, stimulants, and GHB, like I had mentioned before. They reported perceived changes in their sexual thoughts, feelings, and behavior due to the use of their primary substance. So the MANOVA analysis using Pillai-Trace showed that the 3 perceived changes scales, which you can see enhancement, decline, and risk on the Table 1, differed significantly between the 4 patient groups. And the post-hoc tests of pairwise comparison using the Gams-Howell post-hoc criterion showed that the GHB patients and patients who used stimulants perceived significantly more sexual enhancement than patients that used alcohol or sedatives. And then on the right, in Table 2, the patient groups differed in their activity and sexual behavior over the past 6 months before assessment. And the Kruskal-Wallis test revealed that the mean number of sexual partners in the past 6 months differed significantly between the 4 groups. And more specifically, the Mann-Whitney test showed that that the mean number of sexual partners was significantly lower for patients that used alcohol than the patients that used stimulants. And then lastly, the chi-square analysis showed a significant difference between the 4 groups with regard to the percentage of having more than 2 sexual partners in the previous 6 months, and it was much higher for GHB patients than patients that used alcohol or sedatives. Jumping into the next study, 10.2% of these individuals had intercourse in exchange for money or drugs. 71.4% had sexual intercourse under the influence of alcohol or drugs in the last 6 months. And then 13.9% reported having suffered sexual abuse in childhood. And the tendency to engage in risky behavior was shown to be higher when the individual is unemployed. This last study used an 11-item subset of questions for analysis, and these items represented the domains of sexual drive of the patient, their performance, pleasure, obsession, risk-taking, entanglement with drug use, and treatment for sexual behaviors related to drug use, just to name a few. And the chi-square results comparing gender within each of these drug categories are shown to be significant with a p-value of less than 0.001. And all items except 2 of those 11 subsets showed large gender differences, especially in the cocaine group, with males endorsing each item at a higher rate than females. So overall, some of the discussion and conclusions that we can make from these 3 different papers and studies is that substance use does lead to a change in sexual thought, feeling, and behavior for a patient. And there is definitely a relationship that exists between the use of a psychoactive substance and their sexual behavior. And then the different categories of psychoactive agents were associated with different effects on sexual behavior, and the effects can also vary by gender. So overall, the significance of these studies is that we should really address the relationship between substance use and sexual behavior in terms of treatment programs in order to develop treatment strategies during drug-sex-related situations in recovery. Otherwise, risky sexual behavior will continue if it's left untreated. And some limitations of these studies overall include the validity of instruments. Because most of these surveys were self-reported, the first study did not address inpatient versus outpatient settings in terms of treatment programs, which could be playing a factor. And there was also a really small sample size of GHB users. The second study, the samples were selected out of convenience, just to name a few limitations. And then ultimately, some future research could be, especially for the first study, assessing the differences between perceived and actual sexual thoughts. The second study could also look into gender differences on the studied sexual behaviors to see if gender plays a role. It could also do a study proving an association between the use of multiple partners, inconsistent condom use, and sexual intercourse under the influence of substances as risky sexual behaviors. And then lastly, for that last study, the development and implementation of strategies to address issues related to these interconnections between sex and drugs could definitely be addressed. And below, I just have my references. Thank you so much for listening, and if you have any questions, please feel free to reach out and leave them below in the forum. Thank you so much.